The School District of La Crosse is receiving tens of thousands of dollars in grant funding now to expand mental health training for educators around the district. Crystal is back with us once again. And Crystal, how's the funding being used and who's being impacted?
Well, Dustin, this funding supports district-wide training in a brain-based education model with the goal of reaching every school building over the next few years. The district received a 4-year, $55,000 grant from the WEA Member Benefits Foundation to fund training in the neurosequential model in education, or NME. An additional $10,000 grant from Mayo Clinic Health System will support classroom and school-based implementation. Now, NME is not a program or a curriculum. Instead, it trains educators to understand how stress, adversity, and trauma affect brain development and how that impacts student behavior and learning.
We're really excited to use those grants to move our framework beyond just providing therapeutic support and counseling supports to students, but to really enhance our ability in every school building to provide safe and therapeutic supportive settings and relationships for all students.
The district already provides counseling, telehealth therapy, and partnerships with community providers. And staff say this training expands that work by focusing on how staff interact with students throughout the school day, not just during scheduled services.
When I've had conversations with staff, I think they're surprised because they're doing a lot of this good work, but it's now grounded into a foundation that's backed by really good research and evidence that if we do these things right, that kids can engage better with their learning despite their background or the adversity that they've faced.
Now, 20 staff members, at least one from every school, are a part of the first year-long training cohort, and the funding will support 3 years of training, reaching up to 60 educators district-wide. Dustin.
So, Crystal, how is this going to look like when it's put into practice?
What I'm told from these staff members from the year-long training in literature, it's everything from anticipating a student's needs to social emotional regulation, creating relaxing atmospheres in a classroom and spaces for students to go if they need to regulate themselves.
Okay. So things like dimming the lights a little bit in the classroom. I love that because I feel like that just helps me focus better when I'm doing work in the mornings.
And especially with all of the harsh lights, it's hard to focus and stay focused.
We could turn these lights down a little bit.